Hello world, Afshen Inhlikani Riperile, and welcome to the second episode of 9Cubed series. In this episode, I had an opportunity to have a chat with Dr. Lerato Rametse, who also happens to be a PhD student at the University of Cape Town. I hope you enjoyed this chat as much as I've enjoyed. Can you please briefly tell us who is Dr. Kosnet?
Hi, Best. Firstly, it's such a pleasure to be on your platform, and thank you so much for inviting me. Who is Dr. Dr Lerato Rametse? That's your question, right?
Yes.
So I was born and raised in Limpopo province in a rural area called Ramadikana. I'm Betty, raised by a single parent, grew up with my cousins. As you know how African culture works, you have many siblings, which is a blessing. Grew up surrounded by many boys, and I went to primary school in a small Afrikaner town not far away from my rural area. We had to use taxi to travel to go to the school, and it was called Dendron Light School. And I then went on to do my high school studies in Dendron Secondary School, and yeah, that's where I matriculated.
Okay, and I think for everyone, just to put it on record that this is not an honorary doctorate. So what did you do after high school?
Definitely not. Definitely not best. So I mean, obviously, after high school, I got accepted into medical school at the University of Cape Town. So I moved to Cape Town, and that's where I started my medical school journey. And in the process, I became part of a program that is called the UCT Intercalated Program that was pioneered by the late Professor Bongani Mayosi. It's basically an MD PhD program, and the vision of that program basically is to provide an efficient way for early career clinicians to become clinician scientists, so to engage in both research and clinical work, which was spectacular. And it was such a privilege for me to be part of the early group, so one of the first groups to trial out the program. And I was part of that program, so I did my BSc Med Honors in between my medical studies in infectious disease and immunology. And that's where I got a taste of what research is like. And then I went on to finish my medical degree, went to do my internship, and came back to do my PhD. So currently I'm a PhD candidate in the University of Cape Town again, Division of Immunology.
What's your research about as a PhD student?
So my PhD is about basically understanding HIV transmission in males. So basically, Best, I hope that this is just a reminder to the viewers that we know we have a high prevalence and a high burden of HIV in South Africa, and we are amongst one of the highest countries in terms of HIV prevalence in the whole wide world. So knowing that, whenever I talk about my research, I like to also acknowledge that we've also come a long way in terms of progress when it comes to HIV, right? In that since the enrollment of ARVs, HIV-related morbidities and mortalities have improved drastically. However, the number of new HIV infections are still alarmingly high. And according to the latest records, in 2019, 1.7 million new infections were recorded globally. So that's a lot of new HIV infections. Now, what that means is that it encourages us as people that are interested in combating or controlling this pandemic to understand, put more efforts in understanding more how HIV transmission works and how we can come up with alternative preventative strategies to what already exists. So what we know about HIV is that the majority of the prevalence prevalence that we see of HIV is amongst women of reproductive age. What that has led to is that a lot of research has focused their work on trying to understand HIV transmission through the female reproductive lens. However, there's very little studies or very little effort towards males and understanding HIV transmission within the male penis, because we know that the commonest mode of transmission of HIV is through heterosexual intercourse. So that's where my project comes in. My research focus is to try and understand how asymptomatic sexually transmitted infections influence HIV susceptibility in the male penis.
Had you always known that you wanted to be in health sciences? Or do you remember a time where you knew that, you know what, this is it, I want to be in health sciences?
I wouldn't say always, but for majority of my life, yes, because I grew up in a rural area, as I said, and I think that, as a child, and I don't know if you can relate to this. There were a lot of observations that I made as a child in my rural community, given that there were, even within rural areas, there are still classes of different classes of economic statuses. There are still different backgrounds. I used to notice some things that when I look retrospectively were actually diseases. It was cases of malnutrition, cases of TB. Given our historic nature, there was also the case of how a lot of married women in rural areas had their husbands living in the cities. And usually what would happen is that they would come back very sick. And what we would always see constantly were these men coming back being short of breath, taking breaks because of the transport system being so difficult. So you'd always see these men coming with their bags, being short of breath, taking breaths every corner. And I would be so curious as a young child, what is this pathology? What is this disease? It seems to be very common. It seems to be very prevalent. It's things like that got me really into health sciences. So it's from that point that I knew I wanted to understand the human physiology. I wanted to understand how should a normally developing child look like, because there were so many that I looked at in my rural area sometimes, and I would be like, is that hair normal? Is that abdomen normal? There's something that doesn't feel right, even though I'm not a doctor. So that's how I've always I kind of always knew I had to do something in the health sciences. Yeah.
And if there's one thing that would stand out for you that you love the most about being in health sciences, what would it be?
Sure, that's a tough one, because health sciences is also very broad. We can talk about it in the context of doing research in health sciences, but also practicing as a clinician. But I think for me, I think the most exciting thing, given my specific position, is the fact that I have the opportunity as a clinician scientist to both practice medicine and do research and bridge the gap between the two areas. I think that has been the most exciting thing. And I think that in medicine, people who are in medicine know that we use the principle of what we call evidence-based practice. And so it's very clear that, as a clinician at the bedside, you need what the scientist has generated to properly manage a patient. But also as a scientist on the bench side, you need to know what's happening on the bedside in order for you to derive or come up with relevant projects. You're not just you don't want to be spending your time doing projects that are not going to apply to the needs of your community. So I think the most exciting thing for me is the fact that I get to be both on the bench and in the clinic, and I get to kind of see where the need is, but also I get to do experiments and come up with projects that could generate data to help with the management. So that has been really exciting for me.
I remember a time when I wanted to study a PhD, and I tried to look for information, and I could find a lot of information from overseas. And what I couldn't find was, how does a typical day of a PhD student looks like? I mean, of course, it varies from student to student, from faculty to faculty, but how does yours look like, a typical day?
I think that question, on top of what you've mentioned, that it varies from faculty to faculty, it also varies based on where you're at in your PhD level. Whether you're in your first year, second year, third year. But in my third year, I'm at the point where I'm doing a lab-based project. So majority of my time is being in the lab, conducting experiments. And then in between, I'll have journal clubs, meetings with my supervisors. I'll have meetings with my peers to discuss data. I'll attend workshops, seminars. But a normal day-to-day, majority of it is being in the lab and doing experiments. And also trying to squeeze in data analysis, well, not squeeze in, data analysis and readings, keeping up to date, because you have to definitely be keeping up to date in order for you to actually make sure that the experiments that you are doing are actually, relevant and important. You have to keep up to date with your readings. So yeah. I hope I wasn't going back and forth, but I hope I answered your question.
No, you did. And lastly, for those aspiring to be in STEM fields in general, or in health sciences in particular, if you were to give them advice, what would it be? Especially to the young girls out there, as we celebrate and honor the Women's Month, what would your advice be?
Best, I think that the most important thing that I would love young women or young girls to have in mind is that they should never consider doing anything because of convenience. I know that sometimes we don't have options, but if you do have the option, never choose to do STEM because it's convenient to do it. Do it because you're passionate about it. Don't do it because, oh, well, it's there. Because I do think that when you're passionate about it and you're actually interested in it, then the passion will drive you and it will carry you through the journey, because it's a journey. Doing a PhD in STEM is a very complex and challenging but exciting journey. But if you don't have the passion element, you might not really probably even get what it's meant to establish in terms of building you as a person and your skills, but also your mindset, right? So do things out of passion and curiosity, and not out of convenience, if you have the option to.
Thank you so much. I can't thank you enough for your time. I appreciate it.
Thank you so much again for this initiative, Best. I think it's amazing. And like you said, I think it's also it's so exciting. For those who don't know, I know Best from undergrad days.
Thank you so much for watching this video. And that's all that I have to share with you with the interview I had with Dr. Lerato Rametse. Please consider subscribing if you haven't, and consider forwarding the link to anyone you think will benefit by being part of this YouTube channel. Until the next episode of 9Cubed series, from me, Best, na cancer. Thank you very much.